The World Conference on Tobacco or Health. We're joined here by Mr. Mike Bloomberg. He's the former mayor of New York and the ambassador of the World Health Organization, Non-Communicable Diseases. Mr. Bloomberg,
thank you for having me.
Thank you so much. And you feel quite very strongly about this issue of non-communicable diseases. I like, for instance, the initiative that you have taken. Tell us about this one in particular, stopping tobacco organizations and products.
For the first time in the history of the world, more people are dying from non-communicable diseases than communicable ones. A non-communicable disease is something like cancer, for example. You don't catch it from being with somebody else. You catch it elsewhere from something you do, something you ate, who knows what, but it's not a contagious disease. Measles would be a contagious disease. Measles used to kill a lot of people. Today it's cancer and other things like that. Smoking causes an awful lot of things that are bad for you, including cancer. And what we're trying to do is to stop people from smoking. We're also trying to stop people from being obese. Obesity will kill more people than smoking at the rate it's going. There are a lot of things, traffic accidents will kill a lot of people. We can do things about that. There are a lot of public health things that you can do to reduce the number of people who die prematurely and needlessly.
I'm told that at least more than 60% of the people in the low and middle income countries, they die of the tobacco-related products.
Smoking is something that people do generally when they don't understand the damage that it does to your health. Those people would tend to be people with less education because they don't understand how science works and what smoking can do. And the tobacco companies target people with low levels of education, which typically also mean people that are poor, because education and poverty go together. But what the tobacco companies are looking for are people that don't know that their products, if used the way they're advertised, will kill you.
But isn't that the case that now there should be more funding, especially in those areas, for instance, in the low and middle income countries?
Well, my foundation has spent close to $1 billion so far in trying to get the message out that smoking is bad for you, not just in the United States, but around the world. Here in South Africa, but all through Africa and Latin America and Western Europe and North America and in Asia. It takes an awful lot of money to go and to explain to people that this is bad for you. And yes, it may give you a sense of confidence and it may feel good and it dulls your pain a little bit and that sort of thing. But you don't want to smoke. It's very bad. And the cigarette companies know that educated people are stopping smoking a lot, most of them. So they're targeting the poor, uneducated people.
In South Africa, they stopped at least 19 years ago from advertising tobacco in public
places.
That's a step. And there's a lot of, the Minister of Finance is putting sin taxes, targeting especially tobacco products.
That's a good idea.
But it doesn't look like we're making a dent in this gauge.
Well, I don't know that. I'd have to look at the statistics for this particular country. Worldwide, cigarette consumption has finally started to go down. If you take a look in like Western Europe, where people traditionally went to the local bar and had a beer and a cigarette, today they're not smoking in those bars. All these countries have banned smoking. And it's one of these things that there's a few people that joke about it, there's a few people that break the law, but generally consumption among teenagers has gone down by 50%, gone down by 30% from adults, and it's been successful. There is still a long ways to go, and if we don't keep fighting, the tobacco companies come back with ads that are misleading and statements that just literally aren't true, where they try to convince you, oh, there's nothing wrong with smoking, don't believe those people. If you go back to when I was young, every cigarette company ad had a doctor in a white coat in the ad. The good news is they're all dead now, because if they smoked, it would have killed them eventually, but they're all older.
That's impressive to hear that. But you have countries like, for instance, Zimbabwe, just in south of our borders. Tobacco is almost one of their commodities, and it plays quite a vital role.
I understand that, but that doesn't mean, however, that people in South Africa shouldn't stop smoking. It doesn't mean that we shouldn't try in Zimbabwe to explain to them what smoking does for you. If what they do in Zimbabwe is they grow tobacco, and you say, well, if you don't use tobacco, it's going to hurt their jobs. Try to equate what is a job worth versus a life. We can find and create other jobs. You can't find another life once you die.
And finally, Mr. Bloomberg, I will try to peg these two questions back to back because I'm running out of time. 2/3 of death in the world are unrecorded.
That's true.
Would you think that based on that, the figures that we know about people dying on tobacco-related products,
they're probably
just a tip of an iceberg, number one?
Africa has a very low rate of reporting deaths accurately. And that's one of the things my foundation is working on, because if you want to help people, you got to know what they die from. And your second question?
My second question, Mr. Bloomberg, would be is this a winnable war?
We're winning it all the time. We just have a long ways to go. And it's one of these wars that if you stop fighting, it comes back and you lose ground. So this is a never-ending thing. The tobacco, unless you could hold the tobacco companies responsible and make them pay for killing people, this is a battle that's going to keep going on. But to say that we haven't made enormous progress is ridiculous. All of Western Europe, all of North and South America, a lot of places in Africa, smoking is not allowed anymore in public places, restaurants and offices and sporting events, and a lot fewer people smoke. But there's these new technologies like vapor, which still gives you nicotine, just does it in a different way. There are new people coming along that haven't gotten the message. They've dropped out of school, or the schools aren't good enough to teach them what's really happening. It's a battle that will go on for a long time.
Mr. Bloomberg, on that note, let us hope that we eradicate this scourge totally.
And my advice, don't smoke.
Thank you so much.
You're welcome. All the best. Good.
All right, Manelisi with Michael Bloomberg saying don't smoke. And from tobacco to tourism, the International Travel Exhibition has officially kicked off in Berlin in Germany, with more than 180 countries attending the travel trade show. This is the world's largest tourism trade show, where South Africa will show the globe what it has to offer. Various travel agencies, tour operators, car hire companies and small and medium businesses from this country are taking part in the exhibition. The trade show expected to run for 5 days, starting from today until the 11th of March. Mbali Sebanyoni is in